kind of speed things up just a bit, and I want to take you to a quick discussion on coding for deliveries. Just ICD-10-CM coding for deliveries. All right. There are some specific guidelines that I want to bring to your attention. Guideline C15B3, when a patient is admitted for a pregnancy complication and there's no delivery, you're going to code that complication as the reason for the encounter. Say a patient has preeclampsia and they're admitted into the hospital and they don't give birth. Of course, preeclampsia will be your first listed or your principal diagnosis. All right, guideline C15B4, when a delivery occurs, if a patient delivers via C-section, the circumstance that necessitated the C-section should be sequenced first. That's anything, any type of delivery. When a delivery occurs, the circumstance that necessitated the delivery will be sequenced first. And I also want to let you know, C15N1 and C15N2, when there is an uncomplicated or resolved complication and the outcome of delivery is normal, you're going to sequence 080, normal delivery first, followed by your single live birth code. That just tells, and this is for the mom's record only, and this just tells you the type of delivery, the type of delivery. And it's only on the mother's record. And don't confuse it with Z38.00. Don't confuse it with that. Now, just so you know, episiotomies, they're considered normal. Yeah, they're just making a little slit into the perineum, so that's pretty common. All right, this is how you code an obstetrical case, and I'm going to just show you, and you can do the next one on your own. All right, Miss Stephanie, please and thank you.
Thank you, Miss J. A080, 082, Z3A.38, Z37.0. B 080, Z3A.38, Z38.00. C 080, 082, Z3A.38, Z38.00. D 08, Z3A.38, and Z37.0. A 38 weeks pregnant patient presents to the hospital in full labor. The patient was experiencing contractions every 1 to 2 minutes. 1 hour after arrival, the contractions ceased. The patient's obstetric, Dr. Thompson, arrives to the hospital, examines the patient, then makes the decision to carry out an amniotomy. The patient began delivering the infant shortly after. The physician incised the perineum to enlarge the vaginal opening to accommodate the delivery. The patient had a normal spontaneous delivery of a single live birth with no complications. The patient and baby were admitted treatment for the next 2 days. What are the ICD-10-CM codes for this encounter? Your time begins now.
Thank you so much. I don't think this is one that has a time because I'm supposed to walk you through it. And if I ask her to read it so that you, if you want to attempt it, to answer it, and some of you have, way to go. Outstanding. All right, so this is what I'm going to do. And if you look at the answers, they're only ICD-10-CM. So there are no procedures that we're coding for. So I'm only going to highlight in yellow my diagnoses. All right, so we have a 30 weeks pregnant patient. We have a normal spontaneous delivery and single live birth with no complications. And in green, I'll put the procedures just so that you know. We have amniotomy, incised the perineum, so they broke the water and they carried out an episiotomy and they had a delivery. They helped the mom deliver the baby. So we're going to code for the normal delivery if we determine that this is normal and a single live birth, and this is a 30 weeks gestation. All right, I'm going to go to my guideline. Normal delivery, uncomplicated, C15N1. I believe it's uncomplicated. There are no complications mentioned. We can code an episiotomy, and that's incising the perineum. In this case, the perineum was incised. And look at the guideline in the right hand column. It says with or without episiotomy. And we're going to sequence 080 followed by the single live birth code. So I'm looking, all right, I do see the weeks gestation. That's appropriate too, but I would probably sequence that last. All right, so we're going to get rid of A because it's coding for 080 and this 082. This 082 is actually cesarean section. So I'm going to get rid of it. Right? You're only going to use 1080 or 082. All right? So A and C have to go. And we can eliminate something else on site, but I'll let you see this in a moment. All right, so the difference between B and D are B is coding for Z38.00. This is a live-born infant code, and this only goes on the infant's record, not the mother's record. And if you go to the subcategory, it says this category is for use as the principal code on the initial record of a newborn baby. Okay, I'm going to let Mr. Sandeep talk more about that, but Z38.00 is a principal diagnosis code and it should be on the infant record. So it is incorrect because they're trying to code it on the mother's record. And Z38.00 is single live born infant delivered vaginally. Not correct. And Z37 is correct. It is the outcome of delivery code. And if you look at the notes underneath, if you confuse the two, you might want to write mother's record only and next to Z38.00, infant's record. But underneath it says this category is intended for use as an additional code. So you don't sequence in first to identify the outcome of delivery on the mother's record. It is not for the newborn record. So this is our outcome of delivery, Z37.0, single live birth. All right, so Z37.0, this is the mother's record. It is the outcome of delivery. And it is only on the mother's record. And it explains the type of birth. Is it single or multiple births? Only on the mother's record. Z38.00, this is the infant record. This is a single live born code for the infant, only on the infant's record. It is principal. You have to sequence this first if this is the first record for that infant. And this explains how the baby was born, vaginal or cesarean, and the location. Where was the baby, in the hospital, at home, in the cab, etc. Now, this is how you code for deliveries, pretty much. I don't know how all right, but there's something else I want to tell you. Whenever you're coding for deliveries and you have multiple pregnancy complications, the code that best describes the delivery is your code, or the reason for that encounter, which will be a delivery, could be labor and delivery, but that is going to be your code. And typically it's going to come from this section, 060 through 082. They're going to be right here, and these are going to be your principal codes. And most important, it should say delivery in the code language. Delivery. All right. Now, when you have multiple complications, here's a circumstance where you have multiple complications. You have this maternal patient who, with diet-controlled gestational diabetes, was seen at 30 weeks gestation in obstructed labor due to footling presentation. And the cesarean section was performed for the malpresentation. There's a lot of stuff going on. Diet-controlled gestational diabetes, obstet- uh, obstructed labor due to footling presentation, and cesarean performed. So what should be sequenced first? Well, we're not going to sequence the cesarean performed because that is not the reason they came. And that is the procedure, the cesarean section, right? So we're only doing diagnoses codes. Sorry about that. I should have said that in the first place. But when a delivery occurs and they have multiple complications, you're going to sequence first the condition that prompted the admission. The condition that prompted the admission is the obstructed labor due to footling presentation, not the patient's gestational diabetes. So you always have to ask yourself, what condition prompted the delivery? And if you don't know, it's often the condition that has the delivery in the answer. So obstructed labor and delivery. When you go look up that code, it's going to have delivery. Okay. All right. So this is why this is pretty much what was going on. The baby was malpresented and not in the proper presentation, not head down. The footling was first. Okay. So they carried out a C-section. There's something else I want to tell you about abortions. There are several types of abortions, and when you're coding, it's imperative that you read just read forensically. I think we've had that demonstration earlier, but just so you know, a spontaneous abortion or a miscarriage occurs without any intervention of drugs or instrumentation. It just happens. It's spontaneous. Legally induced abortions, this is an elective abortion, and it's induced by a medical professional for therapeutic or elective reasons. Illegally induced abortion is not performed by a qualified individual or in accordance with the law. And a failed abortion is when an elective abortion is not successful and the patient is still pregnant. And then a missed abortion means that we experienced a fetal death before completion of 20 weeks gestation. So these are types of abortions. But most important, when you're taking the exam, it's just important for you to pay attention to the keywords. Now, I have one scenario that I'm going to go over with you, let you all solve, and then I'm going to hand it over to Mr. Sandeep. All right, Miss Stephanie, please and thank you.
Thank you. A 080 B 080 Z37.0 Z3A.38 C 080 Z38.00 Z3A.38 D 080, Z37.0, C3A.39. A patient is 38 weeks. A patient at 38 weeks presents for delivery. She has normal vaginal delivery of a healthy baby boy with no complications. What code should be assigned to the mother on the day of delivery? Your time begins now.
Okay, coders. I think you all know how to code these. Outstanding. All right, the key words. We have a 38 weeks patient. She had a normal vaginal delivery of a healthy baby boy, no complications. What code should be assigned to the mother's record? 38 weeks pregnant, normal vaginal delivery, single live born. She had a baby boy, no complications. Well, the guidelines say if you have a normal delivery, no complications, guideline C15N1, sequence first your normal delivery. Then sequence your outcome of delivery second, Z37. So let's go ahead and eliminate some things. We're going to eliminate A because it does sequence the normal delivery, but no single live birth, no outcome of delivery. We're going to get rid of C because it is coding for that principal code that should be on the baby's record, Z38.00. And D is incorrect because it's coding for the wrong week's gestation. Are you all with me? Okay. Okay, we're going to get it, right? All right, so let's go ahead and do our due diligence. If you look at 080, this is an encounter for full term uncomplicated delivery. And Z37, outcome of delivery, single live birth. This is to be used on the mother's record, right? And then we do not use Z38.00 because that's the infant code, and it should be first listed if coded, or if it's an infant's first encounter. And your week's gestation, those last two characters they coincide with the actual code, which coincides with the actual weeks gestation. So this is not 39 weeks pregnant. This is 38 weeks pregnant. So Z3A.39 is incorrect, and Z3A.38 is correct. So the answer is B. So it's really important if you just stash that underneath your belt, and after doing this a few times, you'll get a little more comfortable, and you know how to code a pregnancy, a delivery. That's gold, because you more than likely will have one on your exam. And if you didn't notice, some of you are answering these scenarios without looking them up in the book. Outstanding. All right, so I'm going to hand this over to Mr. Sandeep, who is going to switch gears, and he's going to talk about Chapter 16. Great job, everyone.
Thanks for tuning in, and until next time, happy coding!